Have you ever found yourself talking in your sleep? Waking up terrified without knowing why? Or even walking around your house with no memory of it the next morning? These aren't just odd sleep quirks. They're part of a group of disruptive sleep disorders known as parasomnias. And while they might sound harmless or even funny, they can deeply affect your mental, emotional, and physical well-being. Today, we're discussing parasomnias and uncovering what really happens when sleep turns into something unpredictable. So, what are parasomnias? Parasomnias are disruptive sleep disorders that involve unwanted physical events or experiences during sleep. This includes abnormal movements, behaviors, emotions, perceptions, and dreams. They can happen while falling asleep, during sleep, between sleep stages, or while waking up. The person experiencing them may not even remember the event, but for loved ones, it can be unsettling or even dangerous. Parasomnias fall into two main categories: those that happen during non-rapid eye movement or non-REM sleep, and those that happen during rapid eye movement or REM sleep. Let's break those down. Let's start with non-REM parasomnias. Non-REM parasomnias occur during the deepest stages of sleep. They include sleepwalking, where the person gets up and walks around, often with glassy eyes, but is still asleep. Sleep talking, which is speaking during sleep, often without making sense. Sleep terrors, which are sudden episodes of screaming, intense fear, and flailing while still asleep. And confusional arousals, where a person wakes up in a confused, disoriented state without full awareness. These episodes can last a few seconds or several minutes. And while the person may appear awake, they're usually unaware of what they're doing and don't remember it afterward. The second category is REM sleep parasomnias. REM parasomnias happen during the dream stage of sleep and include REM sleep behavior disorder, where the body acts out vivid, often violent dreams. Unlike normal REM sleep, when your muscles are paralyzed, this condition allows movement, which can result in injury to yourself or your bed partner. Nightmares, which are intense, frightening dreams that cause abrupt awakening and can lead to fear of going back to sleep. And sleep paralysis, a terrifying condition where you wake up but can't move or speak, even though you're mentally aware. These parasomnias can be especially distressing and are often linked to underlying mental health issues, neurological conditions, or trauma. Now, what causes parasomnias? Parasomnias can have many different causes. Some common triggers include stress and anxiety, sleep deprivation, irregular sleep schedules, substance use, including alcohol and medications, medical conditions like restless leg syndrome or sleep apnea, neurological disorders such as Parkinson's disease, and even genetics, which means they often run in families, can all serve as triggers for parasomnias. Parasomnias aren't always a sign of deeper issues, but when they become frequent or dangerous, it's definitely time to seek help. So how does parasomnias affect daily life? Many people might think it's just weird sleep stuff, but honestly, parasomnias can seriously impact quality of life. They can cause daytime fatigue, poor concentration, and mood disturbances like anxiety or depression. Strained relationships due to disruptive or frightening nighttime behaviors. Physical injuries, especially in cases of REM sleep behavior disorder or sleepwalking. And even a fear of sleep because bedtime becomes something to dread instead of a time to rest, are all possible consequences. And if untreated, they can worsen over time, increasing both emotional stress and physical risk. When it comes to diagnosis, here's what to expect. Diagnosing parasomnias usually starts with a detailed sleep history. Your doctor might ask questions like, what happens during sleep and how often does it occur? They'll also want to know, do you remember the events and do others witness unusual behaviors? In many cases, a polysomnography, also known as a sleep study, is recommended. This test monitors brainwaves, heart rate, breathing, muscle activity, and eye movements during sleep. It can help distinguish parasomnias from other conditions like epilepsy or sleep apnea. Keeping a sleep diary and recording symptoms is also helpful. How are parasomnias treated? The good news is, most parasomnias are treatable. Here's how. Improving sleep hygiene, like regular sleep schedules, stress management, and a calming bedtime routine, can make a big difference. Addressing underlying conditions such as anxiety, PTSD, or neurological issues can reduce episodes. In some cases, doctors may prescribe medications like benzodiazepines or antidepressants, creating a safe sleep environment. Removing sharp objects, locking doors and windows, and using bed alarms can prevent injury. Therapy, including cognitive behavioral therapy and trauma-focused therapy, can help reduce stress-related triggers. You don't have to live in fear of your sleep. There are ways to take back control. Parasomnias can be confusing, frightening, and honestly, deeply misunderstood. But they are not a sign that you're crazy. They are not something to be ashamed of. If you or someone you know is struggling with strange sleep behaviors, don't ignore it. Don't downplay it. Talk to a doctor. Get evaluated. And know that there is support out there, and your safety matters. And most importantly, your peace of mind matters. If this video helped you learn something new, hit the like button, share it with someone who needs it, and be sure to check out our other videos.